Good afternoon, everyone. I thank the panel for giving me an opportunity to speak today about the results of the STIMULAX randomized controlled trial. I have no conflicts to declare. This is a common X-ray which we often encounter in patients undergoing abdominal surgery, typically on day 4 or day 5. Delayed recovery of GI function, or what we commonly know as postoperative ileus, occurs in almost 1 in 3 patients. But these rates can vary depending upon the way ileus is defined in the literature. Why does ileus happen? It's probably multifactorial. An abdominal incision or dissection or handling of the bowel during surgery could lead to autonomic dysfunction or release of chemical mediators causing bowel edema. Creating a joint could interrupt the electromechanical transfer, or more commonly, in postoperative setting, excessive use of opioid analgesics or intravenous fluids. All these factors contribute to impaired gut motility. But this does not stop there. Almost all of these patients go on to have one or more complications, such as wound infection or pneumonia. And this down spiral of events cause these patients to stay longer in the hospital and almost doubles the cost of the healthcare services. Thankfully, with the advent of enhanced recovery care protocols, there has been a significant improvement in the way patients are managed postoperatively. These protocols do recommend laxatives for improving recovery of GI function after surgery. However, these recommendations are varied worldwide, with only weak evidence to support their efficacy. Perhaps that explains why, in a global survey conducted in 2019, around 73% of colorectal surgeons were not comfortable using laxatives in their routine clinical practice. And the commonly stated reasons were almost 60% of them felt there was lack of reliable evidence, and almost 1 in 4 colorectal surgeons feared complications such as anastomotic leaks. Though 93% of them were amenable to change if there is good, robust evidence available. And this is where our trial comes in. STIMULAX trial, an open-label randomized controlled trial of stimulant and osmotic laxatives to improve recovery of GI function after colorectal surgery. The aim of this trial was to investigate whether the addition of multimodal laxatives to our current enhanced recovery protocol improves return of GI function in patients undergoing colorectal surgery. All adult patients who underwent colorectal operations, including stoma reversal or formation, were randomized into control and intervention arm. Patients in both the arms received standard of care as per our current enhanced recovery protocol in our institute. The intervention group, in addition, received multimodal laxatives, which were Movicol 1 sachet twice a day, Coloxal 1 tablet twice a day, commencing 6 hours after the operation, and a dose of fleet enema from day 1 in all patients who underwent right-sided resections. The primary outcome was GI2, a validated composite outcome measure for recovery of GI function. It was defined as time to tolerance of first oral diet in the absence of vomiting, along with first passage of stool. Some of the key secondary outcomes were prolonged postoperative ileus, which was defined as patient unable to achieve primary outcomes by day 5, incident of complications such as anastomotic leaks, length of hospital stay, and direct hospital cost. The sample size for this trial was calculated on the basis of best available evidence, which was LAXatives trial, wherein the duration of postoperative ileus was considered to be 4.65 days. We aim to reduce the mean duration by 1 day. And to detect this difference with a power of 80%, an alpha of 0.05, with a dropout rate of 30%, the intended target was calculated to be 170 participants, with 85 participants in each group. This is the consort diagram, which essentially shows that around 278 participants were screened for eligibility, subsequent to which 170 participants were recruited in the trial with 85 in each arm. The data analysis was done by a blinded investigator as per intention to treat analysis. And the results were: the baseline characteristics of the participants in both the groups were evenly matched, as shown in this table, as well as this one. The primary outcome of GI2 was achieved a day earlier in the patients who received laxatives, with a median of 2 days compared to 3 days in the control arm. There was a significant reduction in the incidence of prolonged postoperative ileus, with a relative risk reduction of almost 41% in the patient who received laxatives. This group of patients who received laxatives also opened their bowels a day earlier. There was no difference in rest of the recovery parameters between the participants in both the groups, including overall complications, specifically so in anastomotic leaks. To conclude, routine multimodal laxatives after elective colorectal surgery helps in earlier recovery of GI function, with a significant decrease in incidence of prolonged postoperative ileus, and it also appears to be safe with no increase in overall complications or anastomotic leaks. Thank you very much.